Okay, at this point, I'm going to try and screen share. Yes, my presentation, here it is. Okay. Okay, please bear with me. This is my first time doing something like this. My name is Sakina Alston, and I am in Nursing 511, that is Theoretical Foundations, a multidisciplinary approach with instructor Martha Colvin. This assignment is about a nursing theory review, and I am reviewing Dorothy Johnson's Grand Nursing Theory of the Behavioral Systems Model. So Dorothy Johnson was born August 21st in 1919, Savannah, Georgia. Her education consisted of undergrad BSN education in 1942 at Vanderbilt University in Nashville, Tennessee. Her graduate education is a master's in public health in 1948 from Harvard University. Her career: she was an assistant professor of pediatric nursing. She was also an associate professor of nursing. She was a professor of nursing at UCLA, University of California in Los Angeles, and she retired in 1978. Her model is the behavioral systems model. It is a grand nursing theory. It's based on human needs, and it was first proposed in 1968. Characteristics of human needs theories. They encompass the body, physiology, mind, and social interaction with environment and people. Persons evaluated using this theory are considered the sum of all these parts. Humans are acknowledged as spiritual beings in human needs theories. Human needs theories continues. So humans naturally respond to their environment. Change is anticipated and expected as humans acclimate to their environment, and every effect is related to an affect. We have to find the effect, equate it, and restore it. So we have to find what is influencing the system. We have to see the scope of that, and we have to intervene to restore the system. So this is wanted to get your attention because this is where the behavioral systems model starts to be described in this presentation. So in the assumptions of the behavioral systems model, the system is a patient or a person who is a system of behaviors. The structure is all the parts of the system interlock with the instinctive behaviors to keep the system stable. So the system is a combination of behaviors that work together to keep the system stable, and the system involves the body, the mind, and the soul. So the internal and external effects on the system. So an internal effect would be elevated blood sugar, and an external effect would be cold weather. Behaviors that would affect the internal environment of blood sugar would be eating a lot of candy around Halloween. The would be wearing a hat in cold weather. The nurse's role is to assist in regulating behaviors that keep the system stable. So if a person who is a diabetic comes in with a high blood sugar, the nurse might administer some insulin to bring the sugar back to within normal range. Major assumptions of this theory. The type of behavior and the consequences achieved allow determination of the drive stimulated or the goal sought. So humans exhibit behaviors that are either trying to achieve some type of goal or have been some kind of inside force has been stimulated, such as the yearning to be a mother. That would be an internal drive. So that would cause somebody to exhibit behaviors such as trying to find a mate, or, you know, trying to reproduce. Each individual person has a predisposition to act with reference to the goal in certain ways rather than the other ways. This predisposition is called a set. So we are all unique individuals, so we have different ways that we react to the environment, whether it's a goal or a drive. And our baseline interactions for each individual person is referred to as a set of actions, our go-to actions to handle certain stressors. Each subsystem has the repertoire of choices called a scope of action. So the subsystems will come up later. The subsystems are types of behaviors, groups of behaviors, functions. And then they have a scope of action that is required to achieve the goal or to respond to a drive. The individual patient's behavior produces an outcome that is observed. So what each person does, what behavior they exhibit in response to external or internal influences on the system can be observed. We can see what they do. So these are concepts and definitions. There are several of them. I'm not going to go through all of them, but this first one is behavioral system. The man, or the person, or the human is a system that indicates the state of the system through behaviors. Like I previously said, we can observe the behaviors. So that would be our indication of how the system is doing. Is it stable? Is it unstable? Is it responding appropriately to achieve a goal or in response to a drive? There are more concepts and definitions. I think these first four are important, so I'll go through them. Stability refers to the balance or steady state in maintaining balance of behavior within an acceptable range. A stressor is a stimulus from the internal or external world that results in stress or instability. Structure is the parts of the system that make up the whole. And system is that which functions as a whole by virtue of organized independent interactions of its parts. More definitions. Subsystems. Subsystems are mini systems maintained in relationship to the entire system when it or the environment is not disturbed. I'll get into explaining that a bit more later. So there are 7 subsystems. The third one I'm going to use right here as an example for something later. So ingestive subsystem. This fulfills the need to supply the biologic requirements for food and fluids. So this is a set of behaviors that has a scope of behaviors that will fulfill the needs of the biologic needs of food and fluids. And there are other groups, as you can see here: the attachment or affiliative dependency subsystem, the eliminative subsystem, sexual subsystem, aggressive subsystem, and achievement system. The scientific basis for the behavioral systems model, it's a deductive way of looking at the situation. So because it starts with a generalized theory, so it's a grand nursing theory about behavior, and then it goes down into smaller, more detailed aspects of the system. So generalized theory about behavior and its effect on the system. The behavior is adjusted and then the system is reevaluated for stability. So it starts out big, generalized assumption about behaviors, and then you watch the behavior, you assess the behavior, and then you make more detailed assumptions or inferences about what has been observed. So that makes it deductive. The science that the theorists borrowed ideas from is social science, such as Maslow. Behaviors must meet basic human needs physiologically and protectively and spiritually. And Maslow social science theories suggest the same thing. So the impact on research, education, and practice of the behavioral systems model. It utilizes quantitative data to measure problems, implementations, and outcomes. It's supportive of evidence-based nursing practice, and it has origins in positivism. So UCLA Neuropsychiatric Institute and Hospital utilizes the behavior systems model to guide autonomous nursing practice in all of its units. I'm sure there are several other hospitals and curriculums that do the same. Subsystems can be used to make nursing diagnosis, intervene, and evaluate. So it promotes or evaluates safe and quality practice by using evidence-based practice and setting guidelines and structure for how nursing care can be implemented. So it can be applied in the clinical setting to patients of all demographics, bio, psycho, socio, cultural compass. It covers all areas, all of those areas listed. So an example of how this would be applied is if a patient is vomiting, they cannot exhibit behaviors of the ingestive system. The nurse can observe the behaviors of vomiting. She can manipulate the environment, maybe give some Zofran and she could place an NG tube. She could provide IV fluids. So she would maintain electrolytes with the IV fluids. She could make sure the person is getting nutrients through an NG tube. And she could stop the vomiting with the medication. So the nurse manipulates the environment to facilitate behaviors of the patient so that he or she can fulfill the required behaviors of the ingestive system. Then the nurse can evaluate if the intervention stabilized the system. So you diagnose by observation of behaviors, you adjust behaviors to fulfill the requirements or function of the subsystem of behaviors that make up the whole system of human behaviors. That is what the behavioral systems model is all about. And all of the 7 subsystems can be used in the same way to diagnose, implement, or intervene, and then evaluate. So in summary, the model facilitates efficient and effective behaviors to promote, maintain, and restore health. Function, behaviors of each subsystem should protect, provide, and stimulate. Protect from harm or noxious toxins, provide nutrition for growth and knowledge growth, and stimulate the development of the human. Instability to the system requires nursing to promote behaviors that will restore stability, as in my example previous. Do you have any questions? Thank you. Here are the references from where I got my information. Have a great day.